There's a reason why I say if you have 3 or more years of experience and you work inside of the healthcare industry, you really shouldn't be making under $32 an hour, because you can make up to $31 an hour inside of health information management with less than 3 years of experience. So once you've gotten over that hump, that initial stages of being entry level, it's game on. Hello, everyone, and welcome back to my YouTube channel. It is Valerie, your HIM career strategist. Today, I'm going to be sharing 6 new job leads that do not require 3 to 5 years of experience. Some of these positions don't require a degree. Some of them do not require certifications, and they have a pretty decent pay range. But I want to share these job opportunities with you guys because I'm seeing it so much that every company wants you to have 3 to 5 years of experience, and that is just so far from the truth inside of the healthcare industry. Someone asked me the other day, they said, where can I find entry-level job opportunities? And I said, well, that's kind of hard to answer because you can find them everywhere. Every single hospital, healthcare organization has entry-level job opportunities available. Even large organizations that are not healthcare related, there are entry-level positions within each company. It's just a matter of knowing how to find these companies and knowing what kind of job opportunities to look for. You might have heard me say this before, not every company uses LinkedIn and Indeed, so you have to go directly to their job board. So I'm just going to share these with you guys to kind of get some of the creative thoughts and juices flowing in your head of what kind of job titles you should be looking for, and also some of the names of these companies here. So let's get right into it. So the first position I have listed here is with Sutter Health. It is a cancer registrar position. It is remote. They are looking for someone with an associate's degree, but they do have listed here that equivalent experience will be accepted in lieu of the degree requirement. And they are also looking for someone who has completed the accredited cancer registrar training program and has the ODS certification. So pretty much to explain this here, if you do not have an associate's degree, but you have 2 years of relevant experience, let's say you've worked in the oncology department, you've been exposed to some of the coding, data abstraction inside of the medical records or whatnot, so you have 2 years of working experience in this kind of department, that would be equivalent to you having an associate's degree. And when I see this inside of job postings and it says relevant work experience or equivalent experience, I like to make sure that it is equivalent to the exact department. So if you have a degree or years of experience in a completely different department, I wouldn't necessarily say that that is equivalent to what they have listed here. So to be very specific, if you have 2 years of experience, and the reason why I'm saying 2 years is because usually to get an associate's degree, it takes about 2 years. So if you have 2 years of work experience in the oncology department, but not the degree, and you're interested in working in a cancer registrar position, and you do have the ODS certification here, then this would be a great opportunity. They're also looking for someone with 1 year of experience, and they clearly stated that they're relevant work experience. And the pay for this position is ranging from $35.43 to $46.04 an hour, which is pretty decent for entry level. This is not 3 to 5 years of experience required. When I look at job leads in general, I try to look for the trifecta. I want the years of experience to be clearly displayed, the education requirement, and also the pay. I do have some honorable mentions that I have in here that I included just because I want to show you guys the different kinds of entry level opportunities and that there's a variety of them. But in general, I try to look for jobs that have all three: the years of experience, the education requirement, and the pay. because let's not waste any time on a position that we may not potentially qualify for. Sutter Health also has another cancer registrar position that is also remote. In this position, they also say equivalent experience will be accepted in lieu of the degree requirement. They're looking for someone with the associate's degree and again, ODS, and they also say 1 year of experience. And the pay for this position is $37.19 to $48.34 an hour. So they're asking for the same degree requirements, same certification, same years of experience. I'm assuming that maybe how proficient you are in this area will determine whether or not you come in as a level 1 or as a level 2. But again, remote opportunity does not require 3 to 5 years of experience, and the pay range is pretty decent for someone coming in at entry level. The next opportunity I have here is with UNC Health. This is located in North Carolina. This is a remote position, and they clearly stated all of the different states where they will allow remote work. I really love when companies do this because oftentimes I get questions of, it says remote, but it doesn't say if I have to live in that exact state. Usually, if a company has a residency requirement, they would list it in the job description, or if there's a mile radius requirement, they will list it in the job description. But if you don't see anything at all that, says that you have to live in that state, then there may not be a residency requirement. But I really love that UNC Health clearly listed all of the states where they will allow remote work for this position. So again, this is the cancer registrar position. It is remote. They are looking for someone who has the ODS certification. It says no education requirement as long as the other position qualifications are met. So at minimum, they are looking for someone with a minimum of 6 months of experience as an ODS at an accredited facility or 1 year at a non-COC accredited facility. Okay, so this right here tells me with the ODS, as long as you have 6 months to 1 year of experience, you qualify for this position here. And they're paying anywhere between $24.73 an hour all the way up to $35.56 an hour. Again, this does not require for you to have 3 to 5 years of experience to qualify for this position. Now, here's my hot take on the cancer registrar positions. We currently have a shortage of cancer registrars in the United States. And I believe that this is the reason why the pay is actually pretty decent in this space. It looks to be like a low barrier to entry. Now with the ODS exam, I have heard that it's a little challenging, but what I will say is if you are interested in becoming a cancer registrar and you do have some work experience in the oncology space and you do decide to go and sit for that certification, then you are definitely setting yourself apart from the competition because cancer registrars right now are highly sought after. Moving on to the next position, I have Cayuga Health here that is located in New York. This is a remote position. It's a health information specialist position, paying $21.63 to $31.25 an hour. For this position here, they actually did not list any years of experience, but health information specialist is it's an entry-level position. And I'm pretty sure if you were to contact the Human Resources Department, they could provide additional information as far as how many years of experience that they require. But I'm going to just take a wild guess here and say that anywhere between 1 to 2 years of experience is required, probably not even the 2, because right here where it says required skills and experience, they're just listing high school diploma or equivalent, good computer skills, good organization and time management skills, strong attention to detail, excellent communication and interpersonal skills, maintains the highest level of confidentiality at all times. They didn't really go into job duties and responsibilities or skills that you would need to have that is specific to working in health information management. So that just kind of leads me to believe that they don't require for you to have a certain amount of years of experience, which is probably why they did not indicate it inside of the job posting. Again, they're paying $21.63 to $31.25 an hour. This is a remote position. And like I said before, I'm pretty sure it's like between 1 year to 2 years of experience that they might expect for you to have for this position here. Moving on to the next position, this is a patient account specialist position with MedStar. This is located in Maryland. They are looking for someone with a high school diploma or GED equivalent. So this position here does not require any AHEMA, AAPC, or HFMA certifications. They're looking for someone with 1 to 2 years of experience in patient accounting, accounts receivable, or related healthcare field required, or an equivalent combination of experience in college education in accounting, finance, or healthcare administration required. So for my folks who have the degree, but you do not have the years of experience, and you're reading through job descriptions and you're kind of cherry picking and saying like, oh, nope, I don't have that, so I don't qualify for this position, because I have some people who will get right to this point here where it says 1 to 2 years of experience in these particular areas and say, well, I haven't worked in this space before in any one of these areas, so I don't qualify. You have to pay attention to how they're using words inside of job postings. If they're saying or if they're saying like preferred or required. So the way this is written as far as experience is concerned is saying you can either have the years of experience or you can have the degree. So if you have an associate's degree, that is equivalent to 2 years of experience. So automatically, if you have an associate's degree in patient accounting, there isn't a such thing in accounts receivable, but something along the financial realms, or if you have a healthcare related degree that's an associate's or a bachelor's, you automatically check off the years of experience requirement for this position. And the pay for this position is ranging between $18.33 to $31.61 per hour. Again, this is pretty decent for someone who has 1 to 2 years of work experience or who just has the degree requirement and trying to get their foot in the door. The next position I have here is with Proliant Surgeons. This is a revenue cycle specialist position, is located in Washington State. Again, this is remote. They're looking for someone with a high school diploma, minimum of 1 to 2 years of a medical billing experience, CPC or other equivalent certification. Orthopedic coding experience is a plus, and experience with NextGen and AMCI, I hope I said that right, billing systems preferred. So again, this is another position that does not require 3 to 5 years of work experience, and it is remote. And the pay is from $19.97 per hour to $31.95 an hour. So when I say these salary ranges, depending on your level of experience, degrees, or certifications that you may or may not have, will determine how much money you make. Also, your ability to negotiate your salary and to leverage any transferable skills that you may have. Okay, just because you're coming in at entry level doesn't mean that you have to start at that base pay range, especially if you have work experience in other industries that can be transferred over into the healthcare industry, or if you've already been working in the industry and you've obtained a new certification and degree, and you're just trying to take your career and your income to the next level by pursuing new job opportunities. But that was 6 positions that do not require 3 to 5 years of experience. And all of these positions at the top of the pay scale are paying around about $31 an hour. And I wanted to show you guys job opportunities that are remote, that's across the US, because I don't want people to think that, oh, the only way that I'm going to receive a pay range of that amount is if I'm working for a company that's in California. These are opportunities in California, North Carolina, Washington State, Maryland, Seattle. Like these are opportunities that are in California, North Carolina, New York, Maryland, Washington State. They're all over the place. This is just 6 of many. Thousands and thousands of entry-level job opportunities get posted in the healthcare industry all the time. I want to show you guys a couple of my honorable mentions. These are the ones that didn't necessarily check off all of the boxes for my trifecta to have the years of experience, education, and pay. But Simon Med, a lot of us know what Simon Med is. It is like one of the largest imaging companies in the United States. Simon Med has remote job opportunities. I came across this one here for a PI billing representative. It is only requiring a high school diploma with 1 or more years of experience and knowledge of medical billing preferred. So let's just say you went to school for medical billing and you haven't sat for the certification, but you have the education and training up under your belt. This might be an opportunity that you might want to consider while you're trying to work your way in getting into a job opportunity with a company that does require the CPB, the Certified Professional Biller certification, so that you can get into a position like this where you're working in the billing space. And then after you get a year of experience up under your belt, you begin to pivot and continue to climb the career ladder. These entry-level positions that I mentioned, I wouldn't expect for you to stay in them for longer than a year, 2 years tops. Like, you're staying in an entry-level position for longer than 2 years, you are significantly reducing the amount of money that you could be making inside of the health information management industry. So we have Simon Med here. The next position is Share Care. I have Share Care here with an enrollment specialist position. It is remote. The first 30 days for this position here is structured training they have listed. I noticed here it says the position start date is March 31st. Due to the structure of the training, new hires are unable to miss any days for the first 30 days of employment. So if you apply for this position, make sure that you don't have anything going on within that first 30 days, because if you take off, you're probably going to be terminated. But again, this is an entry-level position. They're only looking for someone with a high school diploma, minimum of 1 year of experience in sales-driven call center and customer service environment, and experience in clinical environments preferred. Okay, this is an entry-level position. The next opportunity I have here is with R1. You might also see RCM for the name of this company. They have a cash posting associate position. They are looking for someone with a high school diploma, GED, or equivalent, Microsoft Office, including the ability to sort and filter reports in Excel, attention to detail, and problem solving. Pretty straightforward. No certification from AHIMA, AAPC, or HFMA. Pay is ranging from $15 to $24.57 an hour. Again, if you're just in a position where you're like, I'm just trying to get my foot in the door so that I can get some experience, so that I can get over this hump of I don't have any work experience, these are some great opportunities. And as much as I would love to sit here for hours and hours and hours telling you about all of the different job titles and different companies that you can pursue these job opportunities with, I just don't have that much time in a day. But I wanted to share these job opportunities with you guys. Some of these job postings are listed on the Career Connect job board. So if you have access to my job board, make sure that you are using that and that you're checking it periodically. For the positions that I mentioned in this video, I will have them just linked down below. But I just want to let you guys know that not all companies require you to have 3 to 5 years of experience. That's just simply not the case. Companies hire on all levels, and it's really beneficial to companies to hire at an entry level when candidates are fresh out of school or have limited experience, because there's 4 reasons why I say, but the 3 main things is ease of training. It's easier to train new hires and mold them to do things the way that you want them to do things in your office. 2, the long-term investment. If you hire someone in at entry level, there's a higher chance that they may be more loyal to the company. That doesn't necessarily mean that you have to stay, but there's a higher chance that this employee might stay with the company and grow within. And for companies, it's much cheaper for them to nurture their talent and retain you than to have to keep hiring from the outside in. And when I say things that you can continue to scale and grow in your career, that doesn't necessarily mean that you have to leave the company. You don't have to leave the company. You can scale into different roles and positions within the organization. So keep that in mind. And then cost effectiveness from a company standpoint. Because you are coming in at entry level, they may not have to hire at the top of their salary range, right? There's some wiggle room there for you to grow. So because the position says $31 an hour, you have absolutely no experience, no transferable skills. They don't necessarily have to pay you $31 an hour. So it's a win-win situation because you may get your foot in the door and get a pretty decent pay that you're happy with. It may not be the 31, but it's something decent without having any experience. And for the company, they're able to get in fresh new talent and also make sure that they're not maxing out their budget for the role as well. So it's a win-win situation. So just keep that in mind. A lot of times people are having a hard time with their job search on an entry level because one, they don't know what job titles to look for. And I don't feel as though some of these educational institutions where we're getting our degrees and certifications from, that they do a really good job at, letting you know all of the different job titles and all of these different industries that we can work in as health information management professionals. Is one of the reasons why inside of my membership group, why I have that list of 500 different positions that you can pursue and the list of 40 different industries that we work in as health information management professionals. So some people don't know the job titles. Some people don't know the companies' names, like what companies to search for. And some just simply don't know how to write their resume or how to read through job descriptions and, job postings and understand how their qualifications fit a particular role. Like that one example where I said you have to pay attention to if it's saying required, preferred, and or if it's using different verbiage. So these are the things that my members inside of my career strategy program are gaining access to. Last but not least, some folks just simply don't know how to write their own resumes. You most definitely can hire a resume writer. I write resumes, but you are your own best resume writer because you know your work history better than anyone else because it's all in your head. You are your own best advocate. So I'm very much pro arming people with the tools and resources that they need to learn how to be their own best career coach and really hit the ground running versus depending on someone else to do the work for you. Some of these things can be things that you learn on your own. How to write your resume, how to search for a job, how to read through a job description, how to negotiate your salary, how to interview, how to scale up in your career. These are the things that members are learning inside of the HIM Blueprint for Success Career Strategy program. So if you're ready to take the wheel and become the CEO of your career and learn how to do some of these things on your own, how to identify what your top skills are in your niche, and also how to write a targeted resume and read through job descriptions and know how to tweak and change your resume each time you apply for a different job opportunity. If you want to know how to prepare for interviews and actually ace them and negotiate your salary and scale in your career, click the link down below in the description. Check out the HIM Blueprint for Success Career Strategy program and take your career to the next level. Until next time.